There are a lot of factors behind why we see thinning hair, hair loss in younger men and women, middle age, whatever the age range is. One, it can be hormonal, for sure. We see abnormal thyroids, low subclinical hypothyroidism all the time. One of the first signs of hypothyroidism, besides the loss of energy, is hair loss. And so we generally look at all hormones and balance and then try to find a solution. We use different nutraceuticals, vitamin supplements. We use sell and recommend Nutrafol's vitamin line. Most people have heard of Nutrafol. I use prescription strength minoxidil in tablets daily. I've been taking it for 2 or 3 years. There's some before and after pictures on the website, and that's me 3 years ago, I think. And I had one exosome injection. We do exosome scalp injections. We use exosomes for facial rejuvenation, really for a lot of things besides musculoskeletal pain. But I had one injection, and it takes time. Around 6 months is when we really start to see the best effects. But really, mine looked even better at a year than it did at 6 months. I did a second injection at the end of the first year. And it's now been, I'm pretty sure, it's been 4 years since I started that pathway. I used JuveXO's product called JuveXO H, which H for hair has additional growth factors that have been isolated. They're specifically intended to help stimulate hair follicle growth. I did that back in July, I think about 3 months ago. And, it's subtle. We have to take photographs and compare them, because when you look in the mirror every day, you see what's there today and you can't remember what was there. So taking photographs, comparing the photographs is very important. But I think the exosomes now, particularly with the newer products, with the additional hair-related growth factors, let's say, really are the most effective things we do. And then we sell the laser cap device. And there's some red light devices out there that are just junk. You want to make sure that it's a physician-grade device, and that's why we handle and share with our patients laser cap. Once it's purchased, it's guaranteed for life. And so, we recommend wearing that around 20 minutes every other day. And so we really want to combine everything we can to stimulate the hair follicles, to see the best results. And hopefully, it's one injection and done. Maybe a second injection around a year to 2. It just really depends on how we're doing. Now, and I tell people, I have people call that, or that I see they've been bald for a while. No, it's not going to grow hair on the wall. There's a time period. If someone has had some hair loss and baldness for less than a year, 6 months for sure, but less than a year, then there's a good chance we can help wake up those dormant follicles. But longer than that, there's other factors, and it's genetic and sometimes very difficult to see the results that we'd like to see. I think really determining any underlying hormone imbalances and correcting that as part of a treatment program. People with early stage hair loss are the best candidates, because many of those follicles are just becoming inactive, but can be stimulated and helped with both, micronutrients, vitamins, perhaps hormones, and then using exosomes. I've done PRP injections, platelet-rich plasma injections in the scalp for many years. The only drawback is you start with a series of 3 injections around 4 weeks apart, so that we get all the growth phases of the hair. And then for that to work best, you have to do it once or twice a year. And so by the time we do, even though initially it's less expensive, you end up spending more in the long run than just going with an exosome product. And I've done some also with patients' own MSCs, mesenchymal stem cells, or mesenchymal stem cells, however you choose to pronounce it, that we've harvested from adipose or fat tissue. And so they all work well. The easiest out of the box, so to speak, is JuveXO H, is using their product because it's so readily available. We could have it ready in less than 30 minutes. And then we use numbing medication. And so it's not terribly painful. We use a topical anesthetic, but also a small amount of local anesthetic in with the injection. And I found that it's, very well tolerated that way. I think some people see misleading photographs online that it's like suddenly I'm going to have this rich, deep black head of hair that I maybe had at 20. It's possible, but that's not every day. And so to expect 30 to 50% of thickening or hair growth is realistic, many times more than that. But, I think we need to have a realistic expectation and then do everything that we can to help, reach that goal. It's real easy to do. You just go to the link on the bottom of the page here, click on aspen-regenerativemedicine.com or give us a call at the phone number below. We can initially do a telemedicine exam. I need to see what someone's hair pattern and growth looks like. We can send people anywhere in the country to LabCorp or Quest to get some hormone testing done and then come up with what I think would be a reasonable plan. And as I said, if we just don't think it's going to be right for you, I don't want to do that. I like people to be happy with what we do for them. And so we try to select, patients that have the best odds at seeing the kind of improvement that they want to pay for.